Hi, welcome to this new video that will learn the electrical currents for pain control. So what are the most used currents for pain control? We basically have TENS. TENS is the most famous one, which means transcutaneous electrical nerve stimulation. So there are basically these types of TENS, conventional TENS, acupuncture-like TENS, burst mode TENS, okay? There are all other types that we won't cover in this lecture, but there is, for example, breathing TENS. Uh, so those are basically the three most used types of things. And there is also electroacupuncture, which is called PENS, okay, which stands for Percutaneous Electrical Nerve Stimulation. So the first one, conventional TENS, uh, is so all types of things will be represented by graphics. Okay, as you see here, those graphs. So conventional TENS uses high frequency and short pulse duration. As you see here, frequency is high, goes pa 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 pa. So this is high frequency, and the short pulse duration. So this is one pulse, okay, which is short. Conventional TENS selectively activates A-beta sensorial fibers. So if this stimulation occurs in the A-beta sensorial fibers, the sensation that the patient feels when TENS is applied is a comfortable tingling sensation, okay? And there is no muscle contraction produced by the use of conventional TENS. This is more indicated for acute pain, okay? Is that pain, for example, if I am walking here at my house and suddenly I hit my arm here in the table, on the table. So when I hit my arm, the initial pain that I feel immediately is acute pain, okay, which is transmitted by those types of fibers. Whereas chronic pain, okay, is more transmitted by C fibers. And the chronic pain will be that pain that will persist, okay, after a certain time, after I have hit the table. So it's important to mention that when we use electrotherapy, the frequent use of electrotherapy may have like an impact to the patient, because this means that if the nerve fibers are constantly being stimulated, uh, at a certain point, these nerve fibers, they will get accommodated to the signal, to the electrical signal stimulation. Okay, so this phenomenon is called accommodation. So accommodation occurs when nerve fibers, they are constantly being evoked, constantly being activated, so that if today I am using things with these parameters, with these frequencies, with this short, with these pulse durations, uh, tomorrow or after 1 week, repeating like the same procedures, I will have to increase the parameters. Why is that? Because my nerve fibers got used to this electrical stimulation. So it's important that in every session that we are treating a patient with TENS, we constantly monitor this patient and also adjust the parameters for the patient to feel this, in this case, a comfortable tingling sensation. In this other type of TENS, this is acupuncture-like TENS. In acupuncture-like TENS, the frequency is low, as you see here. It's like here, pam, and then pam. So low frequency, and the pulse duration is longer. Okay. The sensations that the patient feels is tingling and also muscle contraction. So we have um, stimulation of both sensorial and motor fibers. So basically, when we use long pulse durations, we are activating motor fibers. Okay, we'll go more deeply into this subject in the next videos. And acupuncture-like TENS is more used to treat chronic pain. Okay, we have the burst mode TENS. This is like a combination of conventional TENS and also acupuncture-like TENS. In burst mode TENS, we have the stimulation is delivered in packages with a number of pulses in each burst. So here, for example, we have 1, 2, 3, 4, 5, 6 bursts, okay, given in this package. But we have an average of 10 bursts, okay, in each package. In this case, burst mode TENS is more indicated for muscle spasms. So this also stimulates motor fibers. We have PENS, which is percutaneous electrical nerve stimulation. Okay, so the difference compared to TENS is that TENS, the transcutaneous electrical stimulation, we place an electrode over the skin. Okay, so we have like a transcutaneous delivery of electrical current. In case of PENS, this is percutaneous, meaning that this is application of electrical stimulation in acupuncture points or meridians. So we have those needles that are introduced to the skin, okay? So it's not transcutaneous, it perforates the skin, okay? To apply this type of electrical stimulation, we need a license. So it's not like all physiotherapists that we are allowed to do. So a license is required. And this type has been mostly observed to induce positive outcomes in postoperative pain. So patients after a surgery that when they feel pain, they can apply this kind of pain of electrical stimulation has been shown effective to treat postoperative pain. To sum up this table, we have the different types of TENS that we mentioned. We have conventional TENS, acupuncture-like TENS, and burst mode TENS, okay? The frequencies they use, okay? So conventional TENS is high frequency, acupuncture-like low frequency, okay? In burst mode, generally we have 10 bursts delivered in one package. The pulse duration in conventional TENS is low, okay? So this is short pulse duration. So This is short pulse duration, therefore there is no muscle contraction here, okay? Only tingling sensation. When we increase the pulse duration here, as you see this number, 200 to 300 microseconds, the long pulse duration induces a visible muscle contraction. So the patient is expected to, we are expected to see this visible muscle contraction, apart from the tingling sensation also, in some types. And the other nice and interesting thing about this table is the possible mechanism of action. So for conventional TENS, we have the mechanism of action for pain modulation is the gate control theory, so gating and the spinal cord here. Why is that? Because we have a selection of A beta fibers, okay, in this type of TENS. And we already know what happens when A beta fibers are stimulated. We know that they inhibit C fibers and also A delta fibers at the level of the spinal cord. And in case of acupuncture-like and burst mode TENS, the possible mechanism of action that is more believed to modulate pain is the release of endorphins, okay, the opioid release. So this is the possible mechanism for the acupuncture-like and also burst mode TENS. When we use electrical currents, normally this is safe to use, okay, as long as we adjust the appropriate parameters for according to the patient's needs, okay. But sometimes these adverse effects, they can occur despite the technique is safe. Adverse effects such as skin irritation can occur if the patient has allergy to the material of the electrodes. Normally the electrodes, they are made of rubber, and if somehow the patient is allergic to this material, it can cause skin irritation or even burn, okay, in some cases, if the current density is too high delivered to the skin. Okay, so it could cause those burn. But in this picture, actually, what you see is allergy. Okay, so this is skin irritation because of the material of the electrodes. And to finish this video, we have the red flags and precautions for the use of TENS. As you see, we have like many contraindications, pacemaker or other active implants, metallic implants, because metals, they are good conductors for electricity, so it could induce malfunctioning of those implants. Okay, we have pregnancy. So those contraindications, they are actually if we apply electrotherapy close to the area, okay, or over the area. For example, in pregnant women, it's contraindicated to apply in the abdomen or pelvic area. The damaged skin also next to the area which the skin where the skin is damaged, okay. Lack of of skin sensation or impaired cognition, because the patient cannot tell if it's burning or if you're giving a shock. So it's important to have this a good comprehension about the the effects that the patient should expect from this technique. Okay. Um, Thrombosis, hemorrhage, tumors in the eyes, internally, meaning internally in the mucosa, so in the mouth, for example, this is contraindicated, and reproductive organs. And precautions, we have basically undiagnosed pain because and active epiphysis over this area. In case of undiagnosed pain, we if the pain is not well diagnosed and we apply TENS, we are actually masking the pain. Okay, so we are not treating the pain, we are only masking it, and it could cause like uh, even a worsening of the case if we don't know what the pain is about. Um, we mask the pain, and then the potential effects could be negative in this kind of patients. Okay, so that's it for now. Thanks for watching.